first drug which tends to be used in the early stages of type 2 diabetes is something called metformin, and this has been one of the most fundamental medications since its introduction. So how does this drug actually work, you may ask? Well, in type 2 diabetes, the hormone insulin doesn't work as well as it should do in the body to lower blood sugar levels, and this is also known as blood glucose. This is termed insulin resistance, and metformin comes into action by increasing the body's sensitivity to insulin, which basically means that the body reacts a lot more effectively to this hormone, which lowers blood glucose. Metformin also helps to reduce glucose produced by the liver and reduce the amount of glucose absorbed by the gut. Other benefits of metformin include the fact that it can help you lose weight, and it also doesn't trigger any hypoglycemic attacks. And these are episodes in which your blood glucose levels are dangerously low and can cause symptoms such as difficulty concentrating, sweating, tremors, any behavioural changes, and also confusion. How do you take this medication? Metformin comes in a tablet format, with one tablet containing 500 milligrams of the drug. And this medication dose is slowly increased to reduce the risk of any side effects, such as having an upset tummy, feeling sick, and maybe having some diarrhea. The usual regime the doctor will explain to you is to start off with one tablet a day after your evening meal. And you have to repeat this for 2 weeks, depending on what your doctor has told you, so this can range between 1 to 3 weeks usually. This is then increased to 2 tablets a day, one after the breakfast meal and one after your evening meal. This is then continued for another 2 weeks. From here you will have to increase your dose to 3 tablets a day, with 1 tablet after breakfast and 2 tablets after your evening meal. And this again is continued for another 2 weeks. And finally, 4 tablets are then taken, 2 after breakfast and 2 after dinner. So you start off with 1 tablet, move on to 2, then 3, and then finally 4 tablets a day. So this process will take around 2 months to complete to reach the final dose, but it's to help limit any tummy issues and any other side effects. So if you experience any tummy upsets or any other issues, what happens is that you have to reduce the dose of metformin by 1 tablet and gradually increase the dose at an even slower rate. So remember to speak to your GP if you have any concerns about side effects and what dose of metformin you need to take. So the GP can also prescribe something called a modified release tablet, and this basically releases metformin a lot slowly into the body and can reduce the side effects even more. What happens if your doctor says you can't take metformin? So there are some instances where metformin is contraindicated. So if you have been told, for example, that your kidneys may not be working as good as they should be, metformin may not be given in the first place to reduce any further risks of harm. So other medications will be there available which can be used instead of metformin and can produce the same effect.